Good afternoon, everyone. I would like to thank KSOS for giving me an opportunity to present in this conference. The topic is patterns of confocal blue reflectance in type 2 macular telangiectasia, also called as MACTEL. The MACTEL in the initial stages is characterized by a loss of retinal transparency, predominantly visible temporal to the fovea, and this is classified as per the glass and body staging into stage 2 MACTEL. Studies have been done demonstrating this phenomenon using short wavelength light, also called as confocal blue reflectance, in the wavelength spectrum of 488 nanometers. And the main idea of using this technology is that the macular pigment loss, which is central to the pathophysiology of MACTEL, is picked up well on confocal blue reflectance. And the typical pattern that we see is well-defined area of parafoveal hyperreflectance in the macular area, and it helps in early diagnosis of the disease. So here's an example which shows a clinical example which shows not much parafoveal graying in the macula, but confocal blue reflectance over here shows a well-defined area of parafoveal hyperreflectance. Fundus autofluorescence only shows a faint hyperautofluorescence at the fovea, and fundus fluorescent angiography shows late phase hyperfluorescent leak from the telangiectasias, and the overall area of macular involvement is great in CBR compared to fundus fluorescent angiography. So CBR is an excellent modality in MACTEL, especially in early cases. So here's an example which shows CBR picking up early changes of MACTEL in the form of parafoveal hyperreflectance in the temporal macula, even before clinical photo and fundus autofluorescence picked up the changes. On spectral domain OCT, we can see a faint hyperreflected dots just overlying the external limiting membrane, whereas no other structural abnormalities are appreciated. So ours was a single center observational study which recruited patients based on a confirmation of MACTEL clinically on gas and body staging, and further confirmed on multimodal imaging. And blue-ray reflection images was confirmed by using a Heidelberg spectralis system using a red-free setting in a specific wavelength of 488 nanometers. We excluded eyes with any other macular pathology and with poor imaging qualities, presence of artifacts, and we also excluded images in which CBR was not done as an initial test, because there is a phenomenon called as bleaching of photopigments, and thereby we give a patient adequate amount of dark adaptation time, approximately around 10 to 15 minutes before proceeding with CBR. So the following were the CBR patterns or grading which we analyzed in our study, and I demonstrated this in our figures over here. We place an ETDRS grid over here centered on the fovea, and we place an imaginary line crossing vertically on foveal center. Any hyperreflectance which falls temporal to this imaginary line is taken as temporal pattern. And in the second pattern, the incomplete pattern, we see the hyperreflectance extending to nasal sectors. In third pattern, we have the complete ring pattern in which the outer and the inner borders of the reflectance are appearing uniform. In the fourth pattern is a broad pattern in which the predominant changes are dragged towards the foveal center. It could have a mixed pattern of reflectance, either hyper mixed with hypo. And the fifth pattern, irregular pattern, in which none of the above reflectance patterns are followed. That's an irregular pattern of reflectance. So analysis was done using Kruskal-Wallis and Fisher's exact test, and 302 eyes of 160 patients were analyzed. Majority were females, and average age of 60 years, and mean follow-up duration of 32 months. So the CBR patterns at presentation and subsequent follow-ups, the majority of the patients had complete ring with inner circumferential hyperreflectance, followed by broad pattern, and only very few eyes had incomplete pattern, temporal and irregular pattern. So the mean best corrected visual acuity actually showed a stepwise decrease as we progressed from the temporal to the irregular pattern, and they were statistically significant. The CBR patterns are compared to the stage of MACTEL. The early stage of MACTEL, that is stage 2 and 3, had majority of eyes in the temporal incomplete pattern, and the complete ring with inner circumferential hyperreflectance had got more even distribution between stage 2, 3, and 4 MACTEL eyes. The broad pattern were mainly seen in eyes of stage 4 and 5 MACTEL, and all eyes with the irregular pattern had got stage 5 MACTEL, that is proliferative stage of MACTEL, at presentation and at follow-ups. So the CBR pattern was also compared to macular area. Now macular area is defined as the overall extent of maximum hyperreflectance seen on CBR. And as we see, the temporal pattern had lesser area of macular presentation at presentation follow-up, and followed by the irregular pattern had the maximum area of macular presentation. So here's a case one example which shows that hyperreflectance is predominantly focused temporal to the macula, as demonstrated by a green arrow. At 12-month follow-up, the patient has presented with faint hyperreflectance involving the nasal sectors, and after 2 years of follow-up, this superior sector has also been filled up to form an incomplete pattern of reflectance. This is another example which has a 4-year follow-up. At the initial follow-up, the patient has got a predominant temporal hyperreflectance pattern. And after 4 years of follow-up, the patient presented with hyperreflectance, even extending nasal to that imaginary line, so forming incomplete reflectance pattern. The OCT changes shows mild progression, which with mild collapse and progression of the ellipsoid zone loss, extending even parafoveally. In this example, we can see that the complete ring pattern with the inner borders well differentiated, but on follow-up, we can see that the nasal sectors, it's showing broadening of reflectance focus towards the foveal center. The inner borders, which are seen delineated by the red arrows, are not clearly differentiated in the follow-up pattern. The best-corrected visual acuity has dropped and the macular area has progressed too. And these changes can be well delineated on spectral domain OCT as well, with progression of the neurodegeneration and ellipsoid zone loss. In this example, we can see that the structural changes are mainly focused on the region enclosed within the inner border of the CBR, whereas the regions external to it, external to the inner border, do not show much of structural changes in OCT. So increased CBR within the parafoveal areas is in all cases, except in different patterns and intensities. And this is mainly related to the lack of macular pigments in MACTIL. So the abnormal distribution of macular pigment was related to the impaired trafficking and storage of 3 pigments, basically lutein, zeaxanthin, and mesozeaxanthin. So dual wavelength autofluorescence similar to CBR also shows a similar pattern of macular pigment distribution, starting initially temporal to the foveal edge, progressing centripetally involving the foveal center, and finally encompassing an oval area centered on the fovea. So the later stages of macular are characterized neurodegeneration considered towards the foveal center. Concluding, CBR patterns are related to the macular stage, BCV, and macular area, with temporal pattern associated early stage macula and broad annulus and irregular patterns associated in late stage macula and with greater area of involvement. So relevance of the study, CBR is mainly seen in early stage of macula, which is very relevant to the clinical diagnosis, thereby helping in counseling the patients about a disease. Thank you. Yeah, spectral domain, the Heidelberg spectralis system. So.
Bleaching, you do not get the same pattern as
we don't get the same pattern. You need to get sufficient amount of dark adaptation, around 10 to 15 minutes for that that exact pattern to again be replicated actually. So it's usually picked up in Heidelberg because it's a confocal scanning laser ophthalmoscope. Any system which uses a confocal scanning laser ophthalmoscope picks up this phenomenon beautifully. Because the blue reflectance also has a small element of autofluorescence. So that's why they say that the bleaching phenomenon is affecting the pigments actually.
You didn't try to correlate with the functional outcomes, like only structurally or correlate?
Yeah, structural, functional, only the visual acuity basically.
You didn't try to correlate in this particular study?
So which one, sir?
The functional outcome with the patterns.
Only the best corrected visual acuity was analyzed as per functional outcomes actually. Yeah.